Have you ever been prescribed Meclizine for vertigo and wonder if that's a medication that's beneficial and if you should be taking it? In today's video, we are going to be talking about should you be using it, its side effects, long-term uses, and what it's useful for. So Meclizine is also known as over-the-counter Bonine or Dramamine, used for motion sickness in small doses, which can be very effective with periodic use. Also, if you have been to the ER or suffered acute vertigo, you may have been prescribed Meclizine. I have a lot of patients who initially is prescribed Meclizine and not been educated as to the pros and cons. When should I use it? How should I use it? How do I justify long-term use? So Meclizine is an antihistamine drug taken at larger doses. It works as a vestibular suppressant. The medication actually suppresses the message from the vestibular nerve to the brain. So it kind of tamps down the activity of both inner ears. So why it's effective, if you have a condition that's affecting your vestibular system, it just turns the volume down. So you don't even get a chance to receive messages to the brain. So you don't know why you're dizzy. You don't know what you're feeling because it's working at a minute level. I tell my patients it's kind of like if you were trying to heal a bicep tear and you put your arm in a sling, it's not active and it won't hurt because you're not moving it. So with Meclizine, that's what it does. It allows you to not use the inner ear. If you don't use it, you lose it. Now that is the long-term consequence of Meclizine. So it makes the inner ear shut off. You can lose or weaken the function of your inner ear. Some side effects of Meclizine are drowsiness, lethargy, and fall risk. So if you are 65 and older, there is a risk of falls, especially if you've been prescribed anything for blood pressure or diuretics. That also increases your risk for fall. Add Meclizine on top, and that is a risky drug. So talk to your provider before taking Meclizine. I've also had a lot of people prescribe Meclizine that don't actually have dysfunction or weakness of the inner ear. And when taking it prolonged throughout the day when you don't need it, it actually worsens the inner ear function and causes weakness that they would not have had if they weren't on that medication. So Meclizine is useful when you are having an acute vertigo attack. So some conditions it can be helpful for are vestibular migraines, active Meniere's disease, and even in some cases, acoustic neuromas. If you have a tumor on the vestibular nerve or the eighth cranial nerve, Meclizine can be useful while you're in that wait and see approach to figure out what to do with that acoustic neuroma. And then if you've had acute vestibular neuritis or COVID that attacks that inner ear, during those first 72 hours, maybe a week, you can take Meclizine to kind of reset your system, and you do want to get off Meclizine as soon as you can. It will slow down your recovery if you do take Meclizine on a routine daily basis. And I really think that's the biggest conundrum that I face, is having patients undereducated on the use of Meclizine, thinking that it'll actually cure their dizziness when all it does is dull it. When you know vestibular system only gets healthy if you use it. So a lot of people are apprehensive about coming off of medication because the inner ear has been weak for so long. As soon as you're off of it, you have full function. And then you go and move or you bend over, you look up, and all of a sudden you feel everything. So you get into this vicious cycle of feeling even more dizzy because you haven't been used to feeling movement or sensation. So all I can say is try to get off the Meclizine if you can. Only use it during attacks and try to move as much as you can without increasing your dizziness for a prolonged period of time. So hopefully you found that helpful on when it's appropriate to take Meclizine and some of the effects of long-term use. If you have any questions, please drop them in the comments below. I'll be happy to answer them for you. And look for future videos on other medications that are often prescribed for different conditions with vertigo.